Everyone, Dr. Nathan Bryan here. You may have heard the news lately that the U.S. FDA, the Food and Drug Administration, is strongly considering banning the red dye used in many of our foods, many of our drinks. And to me, this is the common sense approach to medicine and really ensuring the safety of all Americans, which is the primary job of the Food and Drug Administration. You know, I've learned over the past 30 years in basic science as a professor of molecular medicine is that people get sick for two reasons only. Number one, the body's missing something that it needs. Number two, the body's exposed to something that it doesn't need, like a dangerous dye that's found in our food. Most other countries around the world have banned this years ago. In fact, they never even allowed it into the food supply. So the U.S. is a little bit behind the 8 ball and a little bit late to the party. But the good news is we're seeing progress. Common sense is now coming into regulatory affairs in the FDA. And let's look at the science. Let's base decisions, especially the health of Americans, on data. And the data very clearly show there's really no benefit to these dyes, and it's all risk. So if it's all risk and no benefit, it's a very simple decision. Let's remove it from the food supply, and I think this is just the start. Red dye is one of many toxic chemicals found in our food supply. And so if we go back to this premise that chronic disease is caused by two things, nutrient deficiency, and number two, toxin exposure, let's eliminate the toxins from our food supply. Let's start with the red dye, but then follow the data and make informed, educated decisions on other toxins that are in our food supply. The other major problem, and this is data from the 1940s, the food that's grown in American soil today has 78% less basic micronutrients than in the 1940s. 1940 to 2000, 78% decline in nutrient density in the food grown in America. If we address these two, replete missing nutrients, eliminate toxins, such as toxins in our food, herbicides, pesticides, dyes, that provide no health benefit, then we can make Americans healthy. And I think this is just the beginning for the FDA. There are others that are going to be on the list. There are thousands of chemicals we're exposed to every day in our food supply, in our environment, that have to be addressed. And so this is a huge win for the health of Americans. This is a huge win, I think, for the FDA to make educated decisions, regulatory decisions that are positively going to impact the health of all Americans. So stay with us. We're going to continue to provide you updates, kind of our scientific rationale for decisions based on not just the FDA, but anything that affects the health and wellness of Americans. So we hope we're going to be your trusted source, and come back to see us.